Hi everyone, and thank you all for coming, as well as the people online. Just to start my talk, I'd like to start off with a quick experiment. So, I'm going to clap. And now, after 3, I want everyone in this room to clap on 3. So 1, 2, 3. And that is the difference between one person doing something and 250 people doing something. So when I say the words public health, what sort of springs to mind? Is it people in Ebola suits? Is it mountains of paperwork? Maybe it's vaccines. Or potentially someone just nagging at you to eat some vegetables and do some exercise. Now, public health can be quite a complex topic to sort of get your head around, but I'm hoping that over the next few minutes I can give you all a brief overview to what it is, why it's important, and what we can do to help. So, a commonly asked question at a lot of medical school interviews is, why do you want to do medicine? Which is sort of fair enough. And there's a lot of answers to this question, including a love of science, wanting to work with people, thinking you'll look good in scrubs. But I think a lot of people go into it because they want to help people, which was my reason as well. And as I did my training and as I went through the years, and I've still got many more ahead of me, I realized that modern medicine can only help people so far. Take Mrs. Jones as an example, who has been unfortunate enough to have a heart attack. Yes, we can treat that heart attack with aspirin and stents, but why did she have that heart attack in the first place? How can we stop another one from happening? How can we stop it from happening to someone else? And how do we know that the treatment we are giving her is the most optimum treatment? To me, public health is all of those things. It is health and medicine at a population level, as well as at an individual level. And it is evidence-based, and it's all about protection rather than just the cure. Now, the WHO, or the World Health Organization, defines it as all organized measures to prevent disease, promote health, and prolong life amongst the population as a whole. So where does global health fit into all of this? Now, there's a new definition that seems to come out every year, a new journal article, and even one from The Lancet that said global health is public health. So with all this confusion, what actually is global health? And there's a few underlying concepts that keep reoccurring. The first of which is that it's population health on a global level. It's all about global cooperation. It's not just about rich countries helping poor countries. It's a lot more complex than that. And some of the principles from public health also ring true for global health as well, including that evidence-based approach and the fact it's multidisciplinary. Doctors and healthcare professionals alone aren't going to be the ones to solve all our public health challenges. And finally, the concept of health equity, which moves me nicely on to the difference between equality and equity. And this is quite a famous cartoon you might have seen before. And it's the idea that with equality, everyone is treated the same. But with equity, everyone is given the same chance at success, as you can see from these boxes and how they've been rearranged so that everyone, depending on their needs, can see the baseball game, which is not quite rugby, but it's good enough. I think the other thing that bamboozles a lot of people is how broad a topic it is, because you've got infectious diseases like Ebola, malaria, HIV, you've got non-communicable diseases like heart disease and diabetes, you've got maternal and reproductive and child health, and you've got politics thrown into the milieu as well in terms of what's the most ideal healthcare system, migrant health, and also access to medicines and fair pricing for treatments. And we also have the environment, which might not seem that directly relevant to human health, but the Lancet believes that climate change is the biggest threat to global health and human health over the 21st century because of its effects on agriculture, access to safe water, conflict, and with tropical climates, we get more tropical disease and potentially new disease as well. Now, all of this can seem like a lot to unpack, but I'm here to say there are 3 key parts to public health: prevention, protection, and promotion. So starting with prevention, it's essentially specific, evidence-based population and individual interventions for sort of minimizing disease as well as risk factors. And I say evidence-based because these ideas haven't been just plucked from the ether. They have been rigorously tested in thousands, if not millions of people over the years. And certain examples include screening for certain cancers, supplements, for example, for pregnant women, and vaccines, which can help at not just an individual, but at a population level. At an individual level, when you give someone a vaccine, you're protecting them against a horrible disease such as measles or polio. And at a population level, you get something called herd immunity. So in that top diagram, you have an unvaccinated population. So the disease can spread willy-nilly to the most vulnerable in society, depicted in red, who will suffer the worst consequences of the disease. In the bottom panel, we have a vaccinated population. And as you can see, the people in green are vaccinated, so the disease can't spread to them, and therefore the disease can't then spread to the people that are vulnerable in yellow. Vaccines have also seen a modern-day success story because in 1980, the WHO declared that smallpox, a terrible, terrible disease, had been eradicated, and that was through immunization. The second concept I'd like to talk about is health protection, which is about protecting individuals and populations, again, against infectious diseases. So that's where swine flu and Ebola comes in. And it also encompasses antimicrobial resistance, which is where we've now got these superbugs that our normal antibiotics can no longer treat. It also includes incidents and environmental hazards such as chemical leaks, as well as climate change, which we discussed earlier. And finally, we have health promotion, which is about empowering people to take control of their health behaviours and lead healthier lifestyles. Now, some of the more eagle-eyed among you might notice that that is Caerphilly Castle. And I didn't just include that because I like Caerphilly Castle. It's because a revolutionary, groundbreaking study happened there called the Caerphilly Cohort Study. And the data from that study has gone on to inform over 400 separate pieces of research, including the research that showed us that low-dose daily aspirin can help prevent heart attacks in certain people. That research also showed us that there are 5 key health behaviours that really impact our health, from whether we get cognitive decline and dementia later in life, to rates of diabetes, vascular disease, and cancer. And they found that by changing 4 out of 5 of these behaviours in the Caerphilly Cohort Study, it reduced the incidence of these diseases by the rates you can see on the slides. Health promotion also includes substance misuse, mental health, sexual health, and also domestic violence. And I'm going to let you in on a little secret. Some of the ways that we use to empower people include education, awareness, and policies. And this explains why you might have seen adverts like these on the TV, from the NHS. You might see things like this in your GP surgeries. And it explains why the government is trying to implement policies like this, such as the sugar tax, because they think that it might help us all improve our health behaviours. And now we move on to the slightly scarier part of the presentation. How much do you think having access to good medical care impacts whether you get sick, or if you do get sick, whether or not you get better? Because the answer might surprise you. It's only 10 to 20%. The other 80 to 90% of what determines whether you get sick, and if you do get sick, whether you get better, is the social determinants of health. There's a very eminent researcher called Sir Professor Michael Marmot who sort of came up with this concept and has researched it extensively, and he calls it the causes of the causes. But what does that mean? Going back to our example with Mrs. Jones and her heart attack, why did she have that heart attack? At the end of the day, she had it because her arteries were clogged up and oxygen couldn't reach her heart because of that. And it might have been due to lifestyle factors, which we discussed on a previous slide with our health behaviours. So, for example, she might have had 1,000 Welsh cakes every single day for the last 20 years. She might have smoked 80 cigarettes every single day. She might have never have exercised. And she might have been, quote unquote, afraid of fruit. I've heard that being said before. But the thing is that it's all very well saying that, but then why does she have that lifestyle in the first place? And that is what is meant by the causes of the causes. She might have wanted to have exercised, but didn't have enough money for a gym membership. She might have wanted to have changed her diet, but didn't know how to, or didn't have the time because of a stressful job and a stressful lifestyle. And she might have wanted to have stopped smoking, but didn't have adequate access to smoking cessation support. And that is what the WHO means by the social determinants. They're the conditions by which people and we are born, we grow, we work, and we age. And it is dictated by money, power, resources, and how they're distributed on a local, national, and global level. Long story short, it is the uncomfortable and sad link between health and wealth. And there have been countless studies that have shown that inequality in the way that we live, the way that we work, and the way that we were raised can lead to inequalities in our mental and our physical health. And nowhere is this more stark than when you look at life expectancies. So as you can see from the graph, life expectancies have almost doubled since the 1800s to now. But this benefit has not been shared by everyone in society equally. The lowest socioeconomic groups in this country can expect to live on average 7 years less than those in the highest socioeconomic groups. And to me, that is so sad, so unjust, and just completely unacceptable. Health should be beyond politics and should not be so linked to wealth in this day and age. And over my time at university, I've been very lucky to have been part of an organisation called Students for Global Health, which is a network of all the global health societies from across the UK. And we have a vision in which equity in health is a reality for all. And we hope to achieve this through education, advocacy, and action. And we're actually part of an even bigger international organisation called the International Federation of Medical Students Association, which is a collection of 1 million medical students from around the world, from 123 different countries. And their motto is to act local or think global. But it works the other way around as well, you see, so think global, act local. And that is what sort of inspired this talk. Now, they're not the first, and they won't be the last to use this motto, because it's been used by Scottish city planners, it's been used by businesses like McDonald's, and now recently, more in global health, and successfully so, as you can see from these journal articles. The other thing these organisations have taught me is that as individuals, as students, as a university, we have so much more power than we think we do. Whether it's through student-run organisations, sort of healthy lifestyle and fundraising for charity sort of events like the Cardiff Half Marathon, or world-leading research that's happening in the buildings around us even today, we have more power than we think to disrupt the ordinary and make a change. And never has disrupting the ordinary been more important. We are living through a volatile political climate, a climate emergency, and the gap between the rich and poor is only deepening. And as this graph shows, the richest 1% of the world's population has the same amount of money and wealth as the 99%, which is just bonkers, if you ask me. But there is hope. Through incremental changes, either done over time, over days, weeks, months, years, or by many, many individuals, so individual action, but on a mass scale, so done by 100 people, 1,000 people, even 1 million people, we can make a difference, whether it's through vaccinating our communities to achieve herd immunity and eradicate disease, introducing more recycling options at our workplace or in our communities, or just being a little bit more frugal and thinking about how we approach antibiotics. We can disrupt the ordinary, we can make changes. And it would be very naive of me to say that individual action alone is the panacea to ending all our public health challenges, because policies such as Fair Society, Healthy Lives by the Marmot Review and government-level decisions will also play a huge, huge part. But individual action is a huge part of the puzzle and should never be underestimated. And as humans, we've overcome huge challenges in the past, and we can do it again, whether it's through eradicating diseases such as smallpox, civil rights movements throughout history, and now starting to address our climate emergency. As you can see, the UK's greenhouse gas emissions are starting to fall, and we have the emergence of new leaders such as Greta, and I'm so excited to see what might happen over the next few decades. For every cigarette not smoked, your body starts to recover. For every person that decides to eat a little less meat, the food industry responds by producing more vegetarian options, making more vegan options available, and that has a knock-on effect, making more people consider going meat-free. And for every child vaccinated, we get one step closer to eradicating another disease. And I leave you with the paraphrased words of Anne-Marie Bonneau, aka the Zero Waste Chef. It's not about 1 or 2 people doing everything perfectly. It's about lots of people doing things imperfectly. Thank you.